Hi everybody. I wanted to tell you guys about my surgery. I had my Lapband surgery on Monday, and today is Saturday, and thank God it went well. Like I said in my earlier videos, I didn't tell anybody, so I took a cab to the hospital, and everybody was like, "Is there anybody waiting for you? Is there anybody you want us to call when it's over, or a doctor can go talk to?" And no, and that was okay with me. So I guess I want to talk a little bit about the procedure and maybe how I felt about that. Okay, so I was a self-pay. So I guess the one thing I will say about that, anybody else who's self-pay, I got lied to. When I went to the seminar with the doctor, they gave out the sheet and they said how much it was for Lapband self-pay, and then I went through all these pre-op tests and everything, which my insurance covered those because those like regular medical tests. But and then like maybe 2 or 3 weeks before the surgery, the doctor's assistant came and said, okay, like sent me an invoice, and it was like $4,000 more because the price that they gave me was the hospital cost, and didn't include the physician's fee. Okay, what? So it was like $4,000 more. I guess like $3,900 more. So for those who are doing self-pay, and this was at a Center of Excellence, a university hospital, confirm how much it is, because that almost made me want to switch, but I was comfortable with the doctor, so I'm like, I don't want surgery or anything, but if I'm going to have surgery, I want to go with a comfortable doctor, and I'm just going to have to suck it up, that extra $3,900. Okay, so my surgery was scheduled for 10:30 a.m. I was going to be the second one of the day. And so I got to the hospital because I had to do my pre-op, and I had to get to the hospital at 7:30. So I got there. They were kind of quick. The check-in was quick because I was self-pay, and I handed them my credit card. And but they only asked for the hospital fee. So I was like, "Ooh, did they find out they were wrong?" And I don't have to pay that other. I didn't ask that because I didn't want to bring any attention. But after the surgery, they sent me an email about making arrangements to pay the physician's fee. So I still got to pay that, but that's okay. So I got to the hospital, did that, all the stuff about who do you call if something goes wrong and everything. So that's fine. I go back to the pre-op room, and now I don't want to do surgery anyway, but and I'm not superstitious. I'm a Christian, but I got a little superstition in me. I'm in bed 13. So I was like, is this a sign that I shouldn't have the surgery? So, because I'm in bed 13. So I was like, should I ask them to move me? Is this some foreboding thing? But so I said, okay, suck it up. So I was in bed 13. Okay. So I go in there, and they have to do my pre-op, which I thought I have to walk all over the hospital, but I only had to do labs, EKG, and a chest X-ray. So all the people came to the bed, and they did that, and then I did a urine test to make sure I wasn't pregnant, and then the first anesthesiologist came out, and he questioned me. And always, guys, everybody knows this who, but for maybe some of the pre-ops, always be very, very honest with your anesthesiologist. And not that you wouldn't be honest, but also mention everything. Things you think are not important, like certain vitamins you take. You might think when they say, are you on any medications? Well, I don't have to mention the vitamin, but those things affect your anesthesia and the surgery and stuff. So, like, the only medicine I take is iron supplements. I mention that. If I take a vitamin, I'll tell them that. So they came out and they questioned me, and then another anesthesiologist came out. He was really nice, and he asked if I cold. I said, yeah, and he said, I'll get you a blanket. Now, I thought he was going to get a nurse to get me a blanket, but he came back with a toasty blanket, and then he put it over me and everything, and that just made me feel comfortable. I was like, okay, I'm comfortable with my surgeon. I'm comfortable with the anesthesiologist. So that was it. Oh, God. Then, okay, so part of this video is to tell what happened to me, but some things I didn't know what to expect because I had never had surgery before, so some people may not know exactly what to expect. So, I'm telling. Okay, so here comes the nurse, and she's got to do, they got to take the blood. Okay, she doesn't know what she's doing. So she's sticking me, and I hate needles. Oh, and I'm about to cry, and I'm like, oh my God, oh, no, no, no. Okay, finally, she gets it. No, she puts it in one hand, and then, oh, there was such the horrible pain. Now, I never look when I'm getting like a needle in me. I always turn around the other way and do all that. So I wasn't looking, but then I felt this horrible pain, and the needle was in my hand, and she says, oh, that vein popped. And so my hand had this big lump. And I said, well, is this going to go away? I didn't know if my vein was stuck, popped for the rest of my life. But she says, oh, when the fluid absorbs, it'll go down. So I'm like, okay. So then she sticks me again in my other arm. And then she sticks me in the other arm. And it's just hurting. And finally, she puts it in my hand, my other hand. And it hurts, okay? Because usually you feel it and then you don't feel it anymore, and it hurts. But she takes it down and she got it, and I'm not saying a thing, but it hurt. Okay, so by this time they're done, and then this other nice nurse comes in and she explains that they're going to give me something that has amnesic properties, so I won't remember the stuff that happens. Okay, so by now, and they're like, oh, he's almost finished with the other one, and you'll be going in next. And I think the anesthesiologist comes back again, and he's very nice. And he's like, okay, we're about to go. And then they come and they put the IV, and then they roll me into the operating room. So then I look at the clock, and now it's like 10:30, so they're on time, and this is good. So the surgeon isn't in there, and these other people are in there, and they're like, and some woman's saying, don't put this down here because when you put it down, it could get contaminated once you sit it down. And I'm like, contaminated? Wait a minute, these people don't have their act together? But whatever, so I'm like, okay, you just go through with it. So then I had to slide from the table that I was in, not the table, the bed, over to the other bed. Now, normally wouldn't be a problem, but I got this thing in my hand, the IV, that is hurting me, but we do it. So as soon as I get there and they have me lay down, then I'm out. I don't remember anything else. That's 10:30. All right. So the next thing I know, and this surgery was supposed to take an hour, the next thing I know, I think it's like 1:30. So I don't know if I was woke and don't remember it because I don't remember the tube or something, because the anesthesiologist has said that when they intubate you, okay, when they put the tube in your mouth, that when you wake up, you'll still have it in you because they want to make sure you're woke before they take it out. So I guess if something goes wrong and they need to immediately do something, it's already in there. Or if you can't wake up or something. So they're going to make you wake up and make sure you understand what's going on before you take it out. Now, I don't remember that. Next thing I remember, it's 1:30. And I'm back in the recovery room. And I'm in some pain, but I'm just like knocked out. And I remember them saying, whatever, and I'm just knocked out. So, but I do look at the clock, and it's 1:30, and I'm like, 10:30, 1:30. That's 3 hours. What happened? So I'm like, oh, was the surgery longer? Was I not able to wake up from the anesthesia? And then as I'm laying in the bed, I hear the surgeon in the next bed over saying to the patient, oh, everything went well, and it was good, and you're blah, blah, blah. I'm like, okay. And then I wait, and he never comes over to me. So I don't know if he ever came over, and I don't remember, because the next day when I talked to the other surgeon, he was like, oh, yeah, people don't remember, but he never said they came over. So I still am wondering if my surgery happened, because I had some issues with my liquid diet, which my other video will talk about, because I had to do a pre-op 2-week liquid diet, and let's just say I wasn't all liquid all the time. Okay. So, but apparently I guess everything did go well. So I got rolled into the room because my hospital, you stay overnight. And I was in so much pain. I was like, I don't understand how anybody leaves that same day. Power to you people that leave the same day. But if you have a choice, I recommend staying a day. Okay. So I get into the room, and I'm just like knocked out. So I think by 2 o'clock I'm in the room. I'm just knocked out. Now, obviously, I'm not going to have any visitors, no calls, because nobody knows I'm in the hospital. So, okay, I'll do part 2 because I think I'm at 10 minutes.